Thank you so much. This is really exciting to be here. The panelists and speakers earlier gave me so much hope for HIV care in the region. This has been fascinating and truly inspiring. I wanted to thank Virology Education and the hosts for inviting me here, and also the esteemed speakers. I'm going to talk about U equals U, why U equals U is so important for HIV care and for our progress towards 95, 95, 95. I'm going to show you a little bit of some exciting things. I hope that will inspire you, some campaigns from around the world. And then I'm going to suggest some specific ways to communicate about U equals U and a way forward to progress towards 95, 95, 95. So this is what U equals U means, first of all. A person who's living with HIV who is on treatment and has an undetectable viral load cannot transmit HIV through sex. Who believes this is true? Raise your hand. Okay, most people here do. Okay, I don't need to convince anyone. It sounds like that's good. And Prevention Access Campaign, the organization that I work with, launched the U equals U campaign for 3 reasons. First was to build a global consensus on U equals U. And so we brought researchers together from 4 countries to confirm that U equals U is true. And I'll show you some of the organizations that now endorse U equals U. So that's done. U equals U is a fact. And now we're working on number 2 and number 3, which is to get this information out through partners now in 105 countries, and to make sure that people with HIV have access to early treatment and care so that they can get to viral suppression for their own health and to prevent from transmitting HIV, which is the foundation of ending the epidemic. So why is U equals U a game changer? Why is it so important? First and foremost, it improves the quality of life for people living with HIV. People can have children, have sex, get married without any concern about passing on HIV anymore. One of the first people that I told was a woman from Canada who for 25 years had been scared and anxious of having sex with her husband. So their intimate life was deeply, deeply impeded because of HIV. When she learned about U equals U, now they're engaging and having a wonderful, intimate time. It's really important. And then for reducing HIV stigma, we talked a lot about HIV stigma today and how important it is to reduce stigma as a barrier to access to treatment, to testing, all kinds of things. And U equals U is very much aligned with our progress towards 95, 95, 95. It's extremely important for each stage. So first, there's research, and I'll show you in a minute, that shows that U equals U reduces anxiety associated with testing. So people are more likely to get tested for HIV. And then if diagnosed, they're more likely to start and stay on early treatment so that they can stay healthy and they don't have to worry about passing HIV on to their partners. And also, they're more likely to continue to take their medication and stay virally suppressed for their personal health and to protect their partners. So this is a real encouragement and reason to support universal access to treatment, care, and services, because then people with HIV will have the treatment they need to stay healthy and stay alive, and they won't pass on HIV to anyone, which again is the foundation of ending the epidemic. So I mentioned earlier about HIV, U equals U increasing HIV testing rates. There was a study in South Africa recently that showed that men were 2 times more likely to go in and get tested when they learned about U equals U and testing outreach versus the men who didn't learn about U equals U. And we're seeing testing campaigns all over the world now that have U equals U in the outreach messaging in New York City and Guatemala, all over the place now. And then this was a really important study that we did in partnership with ViiV Healthcare called Positive Perspectives Waves 2, which showed that education about U equals U increases really important personal health outcomes. So this was in 25 countries, patient-reported outcomes. When people were informed by the healthcare provider, they were more likely to report overall health, improve mental health, improve sexual health, increased viral suppression, which is so important, comfort sharing their status, and better adherence to HIV, which is to medication, which is so important again for our progress towards ending the epidemic and for quality of life for people with HIV. So now, where is this campaign that we started in 2016? We now have a partner network in 1,050 partners from 105 countries. That's more than half the countries in the world. They're now committed to sharing U equals U information for all the reasons that we mentioned earlier. You can look at our map and see where U equals U has partnerships in this region. You can see a lot of the surrounding countries in Turkey and Egypt, Israel, Afghanistan, Pakistan, India, lots of Turkey, I think I said already, Spain, as we heard from earlier, have lots of U equals U excellent campaigns. So what are some of the barriers that we're facing to U equals U? Well, one is some people just don't know about it. They just haven't heard about it. Maybe they don't believe in science. They just don't know. And that's changing because this has been out for many years, and I'll show you in a minute who's endorsing U equals U. And so there's less and less bad information online, and that's changing, and we can all change that by sharing this information. And two is, as was discussed earlier, in some cases there are legal barriers. There's lack of authority to talk about U equals U. What if your health ministry doesn't want to talk about it for whatever reason? Now it's completely outdated to not be able to talk about the science, but these are some of the issues. And we'll get to some of the highest authorities in the field are talking about U equals U. And then paternalism, which is really rooted in stigma. So making decisions about people living with HIV, instead of giving them the accurate information to make decisions for themselves. And this is really distressing. One thing that, especially towards key affected populations, we heard a lot in the United States that people who use drugs would not be adherent and that they wouldn't understand U equals U. But the reality is the data show that people who use drugs in the most effective region in the United States have higher rates of viral suppression and adherence than the national average in the United States. So there's a lot of misconceptions about people with HIV, people who use drugs, and transgender, men who have sex with men, heterosexual couples who a partner has HIV, people born with HIV. There's just a stigma against this population that's really damaging to their lives and to progress towards ending HIV. So we need to really change that, and U equals U is a way. And then fear of change. This is just it's human nature to resist change. There's that cognitive dissonance between old ways and new ways of thinking, and that really impedes progress in healthcare and in moving society forward. So we see that in every country, which is human nature, and we can really move against that because now we're seeing the highest authorities in the field are supporting U equals U unequivocally, and I'll show you some of that language in just a minute. You can find all the language that I'm going to show you here on our website. There's, on the very first page, there's all of these organizations, the CDC, UNAIDS, PEPFAR, WHO, and you can just click on that, and this document will come up that has all the backup information you'd need, all the scientific studies from the top medical journals in the world, supporting U equals U. So you don't need to take notes on this. If you don't want, you can come to our website. So the World Health Organization, I think we talked about earlier with Isaac, is endorsing U equals U and encouraging people, saying U equals U has transformed the HIV prevention landscape and is encouraging people to promote U equals U, especially within the healthcare center. The PEPFAR is actually requiring U equals U education of all 50 plus PEPFAR countries. So they're requiring education. And they're also now, for the first time, they're calling U equals U primary and people-centered prevention. U equals U is actually in the first sentence of the paragraphs under those sections in their new country operating plan guidance for all countries. They're also naming Prevention Access Campaign as the leading site for U equals U information resources, which we really appreciate and gives us an open door to many of the countries' health ministries to help them integrate U equals U into their policies, programs, and communications. The United States has endorsed U equals U, Health and Human Services. And then really importantly, the CDC of the United States has been encouraging people to use U equals U. You could see this sentence down here, which again is backed up in our flagship document, saying that you can use materials developed by the Prevention Access Campaign responsible for U equals U. So they're encouraging. I want to just kind of stay on CDC for a minute because it's so important. This is one of their brochures that has U equals U in it. Again, sources Prevention Access Campaign. Lots of language from the CDC, very encouraging, from domestic as well as global. There's even a global U equals U toolkit created by the CDC. They estimate the effectiveness of U equals U is 100% for sexual transmission. Brazil has endorsed U equals U. These are just some of the countries. There's many more countries, but I just want to show a couple from different continents. Japan has also endorsed U equals U. There are national campaigns. Monaco and Canada were the first countries to launch their campaigns. This is Princess Stephanie with her I equals I and the Health Minister of Canada. Also, really brilliant campaigns created by the CDC and PEPFAR and USAID in Zambia. That's the former president of Zambia on the left in the U equals U shirt. Health Ministry of Kenya and the former head of the CDC HIV/AIDS from Vietnam. There's also campaigns, and this is a very poignant moment to talk about campaigns in Ukraine from the Ukraine government and also from Russia. That's a government-funded program on the right with people holding H equals H signs and kids with their H equals H program, a teen program. Now I'm just going to show you some campaigns from around the world. And again, this is just a glimpse. This one was really moving for me because this is a campaign in the Guarao district of Venezuela, which is the oldest indigenous tribe in Venezuela. They have stockouts of basic supplies, basic toilet paper and medications, but they have an M equals M campaign to inspire hope and to inspire a movement around treatment access. There's also a van, U equals U van in Indonesia, O equals O bus in Norway, and buses on the streets of Washington, D.C. China has had tremendous programs, tremendous progress because of UNAIDS China and because of young people in China that have started. There's already been 2 U equals U and PrEP conferences in the last 3 years. The CDC of China has also endorsed U equals U. U equals U has been in many of actually the top 3 medical journals in the world. The Lancet especially, this was the cover of the Lancet last year with U equals U. This is a real excellent article about the ethical obligation of providers to talk about U equals U and why this is so important for treatment outcomes as well as progress towards 95, 95, 95. There's also excellent articles in JAMA and the New England Journal of Medicine. And then U equals U on social media. Again, here's the CDC. This is UNAIDS with the mayor of Paris talking about U equals U and the mayor of New Orleans on the right talking about U equals U. And then this is the National Institutes of Health Office of AIDS Research, the largest and most prestigious HIV funding organization in the world, tweets about U equals U. So you can find a lot of this on social media, hashtag U equals U. And now we'll get into some of the specifics. I know I'm moving really fast, and this is probably a lot of overwhelming information. I'm happy to provide these slides, so please don't feel like you have to scribble notes quickly. The guidelines are easy. People will say it's too difficult to understand this, but that's because they're judging people. People with HIV can understand U equals U. It's not that difficult. Take your treatment, get your labs done, and stay connected to care. And you don't need to worry. Take your medication. Medication only works if you take it. That's kind of the way to get this across. And words and attitudes matter. This is something that we've noticed around the world. These things are very basic. The TLC that we just talked about applies to all human beings. Take your medication, get your labs done, and stay in care. And this really is important. The way you say, the words you choose and the way you talk about U equals U. So we need to be clear, confident, consistent, and conscious. And I'll go into these in a bit deeper. So first, clear. The words on the left open up a little window of risk. That's ambiguity. We can't really speak in ambiguous terms because it's not science-based. We have to be clear. If we want U equals U to have the effect that it does, the reduction in stigma, the increased uptake of treatment, the increased adherence to treatment, the increased viral suppression rates, which reduces new transmissions. These are really important to be clear. So words on the right are all backed by science, by the leading researchers and institutions. Even zero is being said by the leading researchers and HIV researchers in the world and institutions. Again, I said the CDC is saying 100% effective. They don't say that about anything. So 100% effective. So that's basically as effective, like you're as much at risk of getting HIV from me standing across the hall from than someone having sex with someone who has U equals U. That's no risk. And British HIV Association is also encouraging doctors to say U equals U. And then the way that you say it is important. We need to be confident. So one thing that people will say is, look, I believe in U equals U, but use a condom just in case, or PrEP. What that's saying is I don't believe in U equals U, actually. So what you can say is, yes, condoms and PrEP, they're not clinically necessary, but you might want to consider condoms or PrEP because potentially you could catch an STI, or this could increase risk of pregnancy if the HIV positive partner is struggling with adherence. That's another reason, and just for added emotional security. There's no shame about wanting to use other contraceptive methods. And prevention methods. And then this is what we hear a lot. You're only as good as your last viral load test. That keeps people with HIV in fear in between their tests, and that's not science-based. The medications are durable. If you're taking your medication, you're not going to have a significant increase. Blips may be common, but unless they continue over time, they're not a sign of treatment failure. So what you really need to do is be confident. Be confident and say, take your medication as prescribed, get your labs done, and don't worry about it. The other one we hear a lot is, you never know. Well, the truth is we do know, and we need to be confident. And then finally, almost finally, is being consistent. So this needs to be heard repeatedly by the right messengers in the right ways. We need to use lots of different channels to get this out. We heard about social media and PrEP earlier, which is really, really interesting and fascinating and successful way. And then really have these conversations at every stage, whether you're testing someone for HIV, so you're reducing anxiety. As soon as someone gets diagnosed, you want to talk about this right away to give them hope, help them to get on treatment and into care. And then finally, conscious. We need to make sure that people don't feel shamed because they don't have an undetectable viral load. We need to acknowledge that there are many parts of the world because of barriers, social, structural, legal barriers, where people don't have access to treatment, and that we need to use U equals U as what we call the public health argument to remove those barriers and make sure everyone has access to early treatment, regardless of CD4 count, because when people have access to early treatment, that's good for personal health, and that's good for public health. And this is the way to get us towards ending the epidemic. Leave no one behind. So here's our steps towards a 95-95 future. First, governments need to integrate U equals U into their guidelines, their policies, their laws. They need to update these with the science, because when the government isn't behind U equals U, it's very hard for doctors or community organizations to say it. They need that legal authority. Even though the WHO is saying U equals U and the CDC, sometimes governments are resistant to change, but we're seeing that change around the world. Many, dozens and dozens of governments are moving ahead. And educate, as we talked about earlier, and we're doing today, educate healthcare workers about U equals U, how to talk about U equals U with their patients. Again, like we just talked about earlier, there's ways to say it that are helpful and not so helpful. And then promote it repeatedly in communication. So there are organizations and countries, you'll see UNAIDS on social media and other places, where they are continually, every couple days, getting the information out. And that's been going on now for 5-6 years, consistently get it out, because it's going to take some time to change minds about HIV transmission and people with HIV. And then finally, we really need to, again, make sure we're strengthening all the opportunities and access to treatment, care, and services so people with HIV have no barriers to getting treatment and to getting care. Because we know, again, that improves their quality of life. It's the right thing to do, but even if we don't care about their quality of life and it's not the right thing, it's the best way to end the epidemic. So hopefully I think everyone here cares about the quality of life of people with HIV, but we also care about ending the epidemic, and this is key. U equals U is a win-win for personal health and public health. Well, thank you so much. All of this information, again, is on our website. We have a resource center where you can click and download information based on country or language or type of resource or all kinds of different criteria. And this is my contact information. We encourage organizations, we don't have many in this region, to join on to the campaign along with 1,050 other partners, and also countries, health ministries. If you're here from a health ministry, we'd love to talk to you about joining many of the other countries who have signed on. So thank you very much.